Hello, I'm Dr. John Kruse. I guess I will welcome myself back after a week's absence. Good to be here with you again. And I do have two videos to summarize that were one new release, one re-release this past week. A reminder that there is a Reddit forum for those who want to go in more depth, asking questions or sharing experiences. Also, a general reminder that everything I say here is for informational purposes only and not specific recommendations about medications or other parts of treatment. So the two videos from the last that came out this week, one was a re-recording or reprocessing the sound for the smiling in mental health, and the other one was a new recording on anger and mental health. So regarding smiling and mental health, the gist of it was to remind people that smiling isn't just a smile. It's a reflection of an inner emotional state, and sharing a smile clearly has social impact, emotional impact on others. That doesn't mean every smile makes everyone else happy, but there's a strong tendency to. It signals to others that you're more approachable. Smiles are contagious, so if you want to smile, give a smile. And the very act of smiling does have biofeedback effects on the brain, and a genuine smile does increase the likelihood you will be feeling happiness. The second video was about anger and mental health, and that was largely inspired by some of the recent turmoil in the United States, particularly how anger on both sides from protesters against the immigration officials and anger on the part of politicians and police, other law enforcement officers seem to be escalating, and anger is really effective at triggering anger in others. I wrote about this on Medium as well, and it's interesting. So I discussed how to recognize your anger, how to modify or reduce anger primarily by acting in ways against what it's encouraging your body to do. So anger makes you get louder, makes you lean in, and sitting down and whispering and figuring out why you perceive something to be unfair and if there's another framing for it. So part of the article was on diminishing or neutralizing anger, which is often helpful, but numerous places strongly also supported the notion that anger is an empowering emotion, and most of the social rights issues at least in the US, whether Black people would still be slaves, whether women would be not allowed to vote, whether gays and lesbians were allowed to marry. All those changes came about because enough people were angry and carefully directed their anger, so they weren't just lashing out in anger. And I was moderately surprised that I got, in terms of the written article on Medium, some pushback that I expected from people on the far right who wanted to justify all violence and felt all immigrants were evil criminals. That was easy to dismiss because it was pure nonsense. More surprisingly, a lot of pushback from angry people on the left who felt that I was telling them they couldn't be angry and that there weren't important social factors at play, which was interesting because they sort of echoed some of the sentiments of my article, which that they weren't paying attention or regulating their anger. Anyway, I see some questions came in. There were also some, Max had forwarded some questions from Reddit, and I don't have a lot to say on those, so I'll get through them quickly. I see Dennis and others have asked, and James have questions here, but I'll address the Reddit topics first. One from Loner Sky was asking more about medications when someone has simultaneous ADHD and PTSD. Guanfacine, I think, is one of the best medications for targeting both. They were asking whether amantadine was reasonable to try. And again, I can't make specific recommendations, but in a similar situation, from what had been described, that's certainly reasonable that it may help with both dimensions. And buspirone, which I do have, Buspar, in the US is approved for anxiety, but there is a small amount of evidence that it can help with ADHD directly. So I do have a video on that, so that may be helpful there. There's also a suggestion from Designer Study that I interview Ian McGilchrist, who's the left brain, right brain psychiatrist, neuroscientist, literature scholar. And so far I've not, I think just the logistics to me may be daunting. I'm trying to interview someone or do something like that live, but that I will look into that more. And substantial bunch, wanted more videos on prefrontal cortex and specific executive functions. That's a great idea. Right now I have a fairly lengthy backlog. I will let you know, and this will probably be a few weeks before it comes out. I did just record a short talk on lion's mane because that was probably the topic I've gotten the most direct, specific requests for. And I won't steal the thunder of what my conclusions were from that. Sorry. So I see a quiet. Hello, Dennis. I see Dennis is asking, you're stating in some countries, Elvance, which is Vyvanse in the US, Lisdex, amphetamine, is reserved for treatment-resistant ADHD. Does this mean that it's more effective than, it's, say, Concerta? So overall, group averages, and again, individual results may vary. It's very clear from many meta-analyses, and this is not how many of the experts parse the data, but from what I can see looking at the results, amphetamine products are, in terms of measures of efficacy, reducing scores on ADHD symptom scales, what percentage of people are more effectively treated. Amphetamine-based products are the most effective things we have. And below that are Ritalin and what are considered non-stimulants. So I have a whole video on whether Ritalin is really best considered a stimulant or not. I would argue that on several grounds, it actually is much closer to other non-stimulants than it is to amphetamine. So yes, there's good evidence. And the interesting thing is the evidence is there in both kids and adults. Amphetamine products work better or are more powerful. However, the general recommendations from ADHD organizations and pediatric organizations is that medication-wise, children start with methylphenidate Ritalin products like Concerta first. And that's because in children, the side effect profile or burden for amphetamine-based products is higher than it is for methylphenidate products. So it's the cost-benefit analysis. It's not that in children, even the two drugs are equivalent in terms of efficacy. The amphetamine products work more effectively. They just also have more side effects. Excuse me. So if I'm happy if there's follow-up, but I hope I answered that one pretty thoroughly. James Alexander, hello again. Says that some studies claim there's a link between ADHD and GERD, so gastroesophageal reflux disease. Have any of your patients had chronic daily acid reflux, GERD? Did any of them permanently resolve it? And if they did, what it was with medication or surgery? So I can think of the only patients I can recall with severe enough GERD to be treated with multiple medications and or surgery were not patients with ADHD. So I do see people with depression, anxiety disorders. ADHD has been more than half of my work for 30 years. So no, I can't recall any individuals who had GERD as a result of ADHD medications and or whose medications made it worse. So at least what I can say is in my practice, I've not seen a strong association between GERD and ADHD. My guess is if we did the epidemiology, and this is a guess, I'm not aware if the studies have been done, my expectation would be that anxiety and maybe depression are more strongly linked to GERD than is ADHD, but I don't know. So I'll just stop there. So Max is getting back to the anger topic and asks if any thoughts on the paradox of tolerance. Do you think there comes a point where unrestrained anger would be justified? So it's again, I'm not saying you shouldn't be angry. I am saying you should channel it and use it productively. So there's a fair amount of research. I'm forgetting, it's a Stanford, it might be Muller, group who's shown that popular support for causes, even if they have a good cause, is diminished actually by lashing out. So burning Waymo cars, torching buildings, you are losing supporters by anger. Is anger understandable? Absolutely. But is lashing out generally productive? No. And I was just reading a review of a book on criminology suggesting that one of the big problems in our American justice system is that so it posits that there are two sort of different reasons for criminal behavior for something like a murder. The evidence would suggest that the majority, at least 2/3, 3/4 of murders, are people acting out impulsively in the moment. They get angry, they fire their gun. They see someone infringing on what they think is their space, they think someone else being hurt, they attack in violence or extreme emotion rather than a cold, cool, calculated criminal activity. And yet our whole criminal justice system is set up to punish people for their bad decisions. And again, so what essentially this argument is making is that most of criminal violent behavior, this is violent behavior, we can look at other aspects of criminality, are impulsive decisions, not calculated decisions, and treating them if they're calculated decisions misses the point and isn't effective. So again, that's Malcolm Gladwell was summarizing this book in The New Yorker, and they start with an example of a Chicago woman and mother and her high school son go to a quick restaurant. They give a complicated order at a place that usually just does fast, simple food. The guy in back of the mother gets upset that he's used to just going there for fast food. He gets angry, threatens the mother to speed things up. She isn't clear why he's angry. Anyway, the guy punches the mother. The son sees this happening and shoots the assailant. And both the assailant attacking and the son shooting are impulsive in the moment. I'd say in this case, probably anger and fear responses, and treating them as if they were calculated decisions. So the boy wasn't thinking, am I going to face 15 years in life if he was trying to save his mother? Where am I going with this? So I'm not saying we should tolerate injustice, but I think channeling the anger in ways that are likely to get results is more productive. And again, is it human and understandable that at times we will, all of us, lash out or say things or yell or do things that are unhelpful? Absolutely. But so I don't know if that answered your question, Max. So James is, for those ADHD patients who seem to be putting off taking care of their health, the ones mentioned last Livestream with suspected cancer. What distinguished them from other patients? Was it that their medication just didn't work well enough, that they were just unlucky, or were there other factors that led to their premature preventable deaths? I'm also thinking of two different patients I've had, one who's in the midst of it, both of them quite severe ADHD, who put off having neck surgery, which was causing permanent ongoing nerve damage. I'd say clearly their ADHD contributed to their following up on their medical care and getting treatment. But I'd say in both of these, I think the severity of the ADHD is a factor. And there's also some amount of what I would call reasonable fear or apprehension. So, and I'd say there's two different levels of apprehension. I know some people are, say they're worried about having cancer. The worry is in their apprehension, not even of what it would entail, just that that's so scary they don't want to deal with it, versus a fear of a procedure where they know clearly, and both these individuals have had other people they know who had bad outcomes from neck surgery. So there I would say, even if they were going to get a different procedure with a different doctor, there's some specific fear in their situation that was hard for me to help them effectively combat. So I'm sure factors of luck play a role. Medications not working well enough, ongoing severity of ADHD. I'm looking at the other factors James identified. Yeah, so I would say a whole host of answers are contributing factors. So James Alexander then asks, can antacids like Alka-Seltzer, H2 blockers like Pepcid, famotidine, or proton pump inhibitors like Prilosec, omeprazole have psychiatric side effects or interfere with the effects of ADHD medication? And I'm going to count on Max to come up with. So I do have a talk just on acid-base balance. And clearly, these are the drugs that can affect acidity of the stomach and can affect absorption of stimulant medications, which are both amphetamine and methylphenidate are affected by acidity. Most patients, that's not a huge effect, but there's a lot of individual variation. So it clearly can. In terms of whether there are also direct psychological, psychiatric effects of these medications, I haven't seen strong connections in patients. I mean, again, there's a whole issue of some amount of gastrointestinal distress is strongly correlated with anxiety. Anxiety is correlated with ADHD. So there could certainly be connections there. So Max asks, do you think the current times are particularly rougher in terms of socio-political context compared to the past decades you've experienced in your life, or is there some recency bias? So what I'll do is preface this by saying I'm happy to talk about these issues. They do interest me. I am aware that I have political views and opinions that aren't in agreement with others, and others may feel that there's no place for mental health discussion. So if anyone wants to cut me off, what I will say is I think the big change, so I'm old enough to remember I was politically interested from a young age, discussions about political matters in the Reagan era in the US in the 1980s, early 80s on. And my assessment at the time, and maybe I was young and naive as opposed to old and naive, was that both sides agreed on what the facts were, and they just had different opinions about what role the government should have in trying to reduce inflation or unemployment, so there's a philosophical difference about what role the government should have in treating certain problems or issues, and whether things like gay marriage should be allowed or not. But in terms of the facts of the matter, there was agreement. What I think is pervasively absent, and it is absolutely largely coming from the right and Fox News. So what I told patients 25 years ago, there was a lot of attention when Fox News came about how clever and how subtle Fox was at blending news from opinion and op-ed. So they'd have prominent right-wing personalities give a commentary sort of chopped in right with as if it were news when they were clearly just voicing their opinions and presenting it news. That I think is slimy and dangerous. Opinions should be labeled as such. It's not you shouldn't air opinions, but you should label them as such. But what I identified at the time, and I think is much more pervasively a problem, was the lie that Fox News promoted that every other news source was a liar. Because once you inculcate that in your followers, that's very hard to unbrainwash them. So if you tell them, New York Times is just lying, if you tell them, now they're even saying the Wall Street Journal is lying. If you tell them, Al Jazeera is lying, if you tell them the BBC, if you tell them PBS is all lying, then one, it's fundamentally and verifiably not true. But two, it's really hard to unbrainwash people. So what I see is a fundamental difference from most of the other times in our past. And it's not that misinformation hasn't been included. It's how absolutely rampant it is and how the right is so adept at just doubling down and lying with everything from simple, trivial issues like how big was Trump's crowd at his inauguration? We have dozens of pieces of documentary evidence. Or is global warming occurring or not? That's not a question. That is occurring. There may be a tiny wedge of climate scientists who aren't completely convinced it's coming from man-made sources. Even there, it's a minority. But in terms of just refuting things that are there, so I think the big difference is the extent of misinformation and disinformation, because it means there's no way to start communicating because they're not accepting basic facts about a situation. And it was there with COVID. It's there with I've had people responded to my anger article about all immigrants are criminals. And the data is very clear. If you go back, look at it now in the US, if you look at any point in the last 150 years, there are dozens and dozens of studies, all of them supporting that the rate of criminality and violent crimes like murder, rape, robbery are higher among native-born Americans than they are among immigrants. So if you want to get rid of the criminals, you would say, hey, immigrants, come into our country. We're all leaving because we have a higher rate of criminality. That has not penetrated that's a truth, but it's not accepted or believed. So I think that is a problem we're going to need to solve. And with the advent of AI and deep fakes and more plausible sources of misinformation, I haven't seen convincing ways of how we will address that aspect. So, and I do think that's both a mental health and a political issue, and appropriate that I talk about it. So James Alexander is asking if I had any patients who ADHD resulted in them getting other chronic health conditions. So the most specific things I'm thinking of is more disability from neuroorthopedic conditions that could have been treated earlier. During COVID, there was a few studies that indicated people with ADHD were more likely to contract COVID, and that could be from inattention, so less paying attention to wearing a mask or keeping the right distance, or impulsivity of knowing that they should take certain precautions and not following up on them. And given that studies indicate somewhere close to 10% of people who got COVID have had some long COVID symptomatology afterwards. That would be one chronic condition. Part of it is that it's almost everything, and every health condition has a multifactorial input. So attributing it just stood 2 feet from people's faces who were coughing. I mean, seldom do we have one clear-cut case in an individual situation, even though statistically as a group we can see that, yes, ADHD is more associated with this or this outcome. I would say, and ADHD is associated with higher rates of a whole host of conditions, probably more from the behavioral aspects or consequences of ADHD than from the brain wiring itself. So thanks, Max. The video on food acidity is there, the link to that. And Max also asks, people often mention the concept of emotional intelligence. Do you think that's something worth categorizing and has value in a mental health context? And I'm forgetting Daniel. It's probably even on my shelf somewhere. It's a concept that was popularized maybe 20, 30 years ago now. Emotional intelligence as being a predictor of success in social interactions in life and being a separate domain than just ability to know things or manipulate information. So I think it's an important aspect of humanity that does vary. One is, I think some of it can be taught and learned. So there's social skills training. 2 is, as with almost everything in psychiatry, mental health, very bright people spend a lot of time developing scales to measure these things. And almost always the scales are also influenced by other factors as well and may not very accurately assess the strength or severity of a condition trait. So a number twice as big doesn't mean you're twice as emotionally intelligent or half as emotionally intelligent. So, I think it's a useful concept there. So Bear Jobs asked, does having level 1 autism change the type of therapy with which psychiatrists treat ADHD? So I'll make a sweeping generalization, and particularly in the American healthcare system, the vast majority of psychiatrists treating ADHD are focused on medication. It's extremely few, have learned in detail cognitive behavioral approaches for ADHD, which I have some training and experience with. So two things. One is every other comorbid condition, and we know the rule with ADHD, not the exception, the rule is that there's likely to be at least one other comorbid mental health condition, whether it's autism, depression, anxiety, PTSD. So, whatever else is going on should affect therapy. And given that the central aspect of autism is challenges in social communication and interpreting and expressing, that's certainly going to be affecting talking therapy treatments. So I don't know if there's a more specific angle or whether I've addressed it there, but I'm willing to try again if I didn't answer it specifically enough. James Alexander is asking, can untreated ADHD create a greater functional need for a higher dose of medication later in life just due to things like trying to get back to school while working a job or trying to go to grad school over a decade later than their peers when they're mentally slower, less able to handle all-night study sessions and so on? So I guess the question is not treating it can untreated ADHD create a greater functional need for high dose medication later in life? I mean, the only way to rigorously study that would be to have people at equivalent levels of ADHD. And again, our ADHD measure something, but whether they're actually measuring functional impairment or difficulty or challenges in life is hard to assess. And then you'd have to deprive one group of medications and give it to the other and see where they were decades later. So from a rigorous scientific point of view, I don't think we're going to have a lot of direct information on that. And certainly confounding issues. So one is your severity of ADHD and not treating it. I mean, one question is whether medications early in life shape the brain enough so that the severity later in life is different. I think there's a small amount of evidence, or maybe a fair amount of evidence, that could reasonably be interpreted that way. But is that proven? I'd say no. And then the second major component I would identify is having come up with your own ways of muddling through life, some of which may be useful and some may be not so useful. I mean, the longer you practice those, the more embedded, the more potentially adding on your dysfunction they might be. So that's another confounding variable. And the third one is just being out of sync age-wise with their colleagues creates additional social barriers or difficulties. It's not an absolute one. Often people who are a little different demographically, build up greater support or have more support because you're sort of more interesting or different in that regard. So I don't know if I've answered that enough, but I'll move on to your next question. That's some parents on the internet describe their ADHD and high general intelligence children as twice exceptional. Is there anything that stands out about this patient population relative to your other patients? I mean, my first thought is that I still have people coming to me or reporting when I'm at talks or lectures or comments, how often people still are reporting, I'm a doctor, I'm a lawyer, I'm a architect, and 40, 50, 60, I went in and the doctor said, you function too highly, you couldn't possibly have ADHD. And again, part of the definition of ADHD is not only having these symptoms, but they impair functioning and cause some distress. So impairment and distress are important, but impairment of functioning doesn't mean you can't achieve things. And I would say case example number one is a certain president of the United States right at this moment clearly, unequivocally has a host of ADHD symptoms that are not subtle, that are there, that fulfill the whole diagnosis of ADHD. And yet, whether you think he's doing a good job or not, he's achieved a societally sanctioned, very high level of success. So I'm sort of answering a tangential question. But what I would say is that if you have high intelligence, that often makes things more interesting because you can come up with more workarounds, either intentional or just because that's what you are doing to either mask or compensate or lean into your ADHD symptoms. So that's what I'd say there. Max asks, is there something about parenting that makes one forget what it's like to be a child? Seems like many people who had wild years pre-parenting then become authoritarian for tiny issues with their child. So one is, I think there's a general tendency to forget the actual experiences. And why I say there's a general tendency is that authors, or maybe less so artists in other venues who are able to capture the open-mindedness, the curiosity, the innocence and naivete, the joy of childhood are routinely commended for how exceptional and how unusual they are. So I think just with aging, part of it is, I think, as your brain age. I mean, part of it is forgetting processes in general. Part of it is that your brain is actually different and you're processing things differently at that age than your remembering brain. So that may be harder to get into. But a more specific angle that Max is bringing up is people who are wild and crazy are often harsh disciplinarians later on. And I think I'm clearly not speaking for all of them. Part of it is sort of regret, guilt. They did these things and they knew, while many of them might have been fun at the time, many of them had bad consequences. And part of it is guilt, fear, shame that they don't want their own kid to replicate their mistakes or be a victim of those same mistakes. So they take a response that is overly extreme or overly severe. Secondarily is that there are probably ADHD aspects to, again, behaving wildly or more impulsively maybe than your peers that may make it harder to regulate your parenting. So again, emotional dysregulation is one aspect of ADHD. That's probably a contributor to having a more authoritarian than authoritative. So again, authoritarian, if we oversimplify, there's three parenting styles. One is a lax or negligent, where you don't apply rules at all, or infrequently and mildly let the kid do whatever they want. Two is authoritative. So you set some rules, you set some guidelines, but you're able to explain them rationally and enforce them consistently and firmly, but with gentleness and emotional understanding. And the third type is authoritarian, where rules are capricious, not explained, often arbitrary, and often overly fiercely enforced. And a host of studies show that parenting styles do affect the severity of ADHD symptoms, with authoritative being the best fit for most kids, and not just true with ADHD, but depression, anxiety, a host of other things is more likely if you had a upbringing that was either too lax or too authoritarian. So I think, again, there may be ADHD contributors to making some parents be more impulsive, more, again, I often describe part of ADHD as you see the tree in front of you rather than the forest. So if you're overly focused on what the kid is doing right now that seems dangerous, scary, bad, wrong, it's harder to get hold of the context of, is the kid actually generally safe? Is this really not that horrible a deal? It's harder to contextualize or frame things. So James Alexander is asking, what dysfunctional, counterproductive ways of muddling through life have I observed in your late diagnosed ADHD patients? Yeah, I'd say one is there's some people who sort of rely on procrastination as a way of triaging or determining what, if you wait long enough, most tasks really don't matter, even if procrastination led you to missing your job. So I think, again, even though there's a tendency among most individuals to procrastinate, there's some who lean into that and make it more a life coping skill, even though it's a potentially dysfunctional one. I've also seen a lot of people sort of cling to the positive aspects of their being overly brusque, overly honest, overly straightforward, or overly prone to blurting out comments without assessing their impact ahead of time and sort of leaning into, I'm the truth teller, I'm the honest one, I'm the straightforward one. And there may be certainly an aspect of truth to that, but at some level, nobody is ever an absolute truth teller because the truth is so complicated and has so many nuances and aspects and just angles to it that you can't explain the whole truth on any situation. So you're always omitting some aspect. But I certainly know some people who are ADHD and overly self-righteous that when other people leave out an aspect of the truth, they're accused of hiding or obscuring or being dishonest, whereas they can't acknowledge that they themselves are not. And again, nobody could provide the whole truth in any situation. There's just too many angles, aspects to the truth to include them all. I've also seen, again, one style and sort of social interactions of people being too prone to dismissing the feelings of others. So people who are overly brusque, overly insulting to others, minimizing the impact they have on other people's lives. So Michael suggested maybe I could have a written interview with Dr. Mark Rijo on Medium. So that's an interesting thought. So he's a Yale psychiatrist who wrote the book. I have it over here. Frontal fatigue. Frontal fatigue. So it's focusing on the frontal cortex, and his angle is more that almost all of our mental health conditions, depression, anxiety, schizophrenia, and ADHD, PTSD, are involving frontal cortex dysfunction. And there's also a strong overlap between what we write and how social factors, computer technology among them, are weakening, damaging, challenging, wearing out our frontal cortexes, leading to symptoms that look like ADHD. So we had actually even had some brief communication about maybe writing a book together. I feel not overwhelmed, but whelmed with my current project. So that's a good suggestion. And again, if I had someone here to talk, if I ever figure out how to do that, he might be a good person also. Arca Goego, sorry if I'm butchering the name. How much ADHD causation is in the dopamine deficiency instead of literal brain understimulation, specifically in terms of blood flow? When I'm on an amphetamine, I can physically feel my whole brain. So I am leery when people tell me, oh, I just felt a hit of dopamine because I did something rewarding, or I think very often we are conflating or confusing. So one, all of our models of the brain are simplifications. We need to have them to get some grasp on the brain. It's very complex. So I have a lecture on how we simplify norepinephrine or dopamine or what those do in the brain. So in terms of identifying what you're feeling, whether that's different brain blood flow to different areas, whether it's activation of dopamine circuitry, whether it's release of dopamine, whether it's something completely downstream or different from all of that, I'd say we often sort of make assumptions which I think are oversimplifications. So I don't know if I'm answering the question or saying that I don't want to answer the question there. So James Alexander asks, what are the worst cases you've seen of personality disorders developing in patients as a result of untreated ADHD? Again, this may be more political than most people want, but I would say case number one would be Donald J. Trump. Again, meets full criteria for robust ADHD. And in the past, I was more reluctant to say whether he has. So my feeling when I was writing my book 6-7 years ago was the symptoms defining ADHD are completely objective descriptions of behavior. There are some people who said, well, the personality disorders are also defined in terms of behavior. And they are and they aren't. So they describe behaviors, but in all cases, you have to know the motivation of the person's behavior for a personality disorder. On the other hand, Trump has repeatedly, explicitly told us how great he thinks he is. So is he grandiose? He's not just making these statements because he's inaccurate. He's telling us repeatedly of his need to be seen that way. So I think that would be one example of someone with significant narcissism and stemming from ADHD that was not dealt with when he was a youngster. And other, certainly absolutely family factors in his case contributed to how he developed. I've certainly seen people who had combinations of borderline personality disorder and ADHD. I've seen people with narcissistic personality disorders. I'm not sure what, and ADHD, where I think the ADHD was a contributory factor. I've also seen OCD, OCPD, obsessive compulsive personality disorder that seems strongly entwined with ADHD. So James Alexander asks, have I ever had patients who tried to push their political views on me or had an antagonistic attitude towards me because of what they perceived as my political beliefs? I'll come at that. One is sort of political and identity beliefs. So I am gay. I've been married to my husband we've been together 32 years. We have 2 kids who just finished college. My office is in the middle of the Castro, the gay neighborhood in San Francisco. And interestingly, but by some assessments, I don't have strikingly effeminate or queenie mannerisms. So I had one patient who was referred to me by a gay therapist I worked with, who the patient was looking for a gay psychiatrist to help with medications. At that time, I had a home office and a completely separate unit on the bottom of the house, but people could look into part of our front window, and the patient saw a tricycle in the front room. And in their mind, this was 15 plus years ago, that meant I couldn't possibly be gay if I had kids. So that was an issue that they came across. There were also, the first 6-7 years of my practice, I didn't have a home office, and had moved from the Sunset District for my office, a neutral area, to a very gay area. And I had 2 patients, both elderly Hispanic gentlemen, who never came out directly and said it, but had laid so many clues or cues that, why is your office here? And making comments about all the gay people in the neighborhood with some homophobia. So I've lost, both of them decided eventually that they felt more comfortable elsewhere. So that's one realm where politics affected who I was working with, or at least their comfort in working with me. And then, yes, I've had patients. So again, I'll bring up one specific example. I had a guy in his 70s. He was a successful stockbroker. He had clearly ADHD and anger issues. Most of his friends were Democrats, and this was during the first Trump years. He would come in complaining. So he was a Republican. His friends were all Democrats, saying he couldn't he couldn't talk to them anymore. He didn't understand why they were rejecting his views. He came in one day saying, my friends are saying Trump is anti-Semitic. This was after the Trump campaign, or maybe the office had put out, there's some poster or something with clearly stereotypic Jewish figures with money bags influencing some situation. It was a clear anti-Semitic stereotype, which Trump tweeted about or supported or endorsed. And the friend said, or this patient said, Trump has a Jewish son-in-law, so how could he possibly be anti-Semitic? So I felt that was appropriately to directly address how you could be anti-Semitic and still have Jewish relatives. You can even be Jewish yourself and be anti-Semitic. And then further with this patient, he would come in citing, so I think there's a role when someone is citing misinformation. So this person was making false claims about Donald Trump's impact on the economy. So knowing this was a numbers guy and someone into finance and money, I, on my laptop, could produce right there a graph of where inflation had been over the last 12 years, where unemployment had been, how the gross domestic product is done. And I said, this is a chart of this channel. Can you point to me where Trump's 4 years in office began and where Obama's 8 years? And for all of those until the crash of the economy during COVID, there were some fluctuations up and down, but they all showed trends, and Trump's impact on none of those trends. There was no abrupt improvement in unemployment. They were just continuing the same trend he inherited. So any reasonable assumption would be that Trump's policies in the first 3 years had minimum, including his massive tax cut to businesses and really rich people, had no detectable positive impact on any standard measures of the economy. And the person, when they realized that, became quite irate, and shortly after, they stopped working with me. But again, to me, that felt like proper reality testing rather than imposing my views. So you could say, yes, he was trying to impose some of his views. So I will probably over-answer that one. So Max is asking, how does psychiatry approach patients who have a hard time accepting that their behaviors may be motivated by chemicals in their brain rather than free will? I'm probably going to defer on that one. I'm just thinking I could get mired in. Robert Sapolsky has a book that came out a few years ago. I would argue claiming that he's determined, proved that there is no such thing as free will. I would argue that fundamentally his argument is we haven't found it yet and we keep digging down to deeper levels, therefore it can't exist. That to me seems a pretty flimsy argument for such an important consideration. I'd say that maybe more directly, I've had patients who came in and we'll step aside from the political realm where there are lots of social and other support and encouragement for endorsing delusional views. But I'd say intense delusions, it's often hard to work with people who are fixated on them because their view, I've had people who believed they were descended from Princess Anastasia. I had people who believed that their dentists drilled holes in them and were child molesting them. And drilled holes in their skull, and yet were able to repair, or I mean, this is a person who came in with x-rays of their own skull with no evidence that their skull had ever been drilled into. So I'd say delusions are really hard to have people change, and most often the work is trying to open them up to different interpretations of what is going on. I see there's a few other questions, so I'm going to jump away from Max's. So I talked about having some patients with prior amphetamine-induced psychotic episodes who had hidden their history from you to try and get prescribed stimulants again. How did you end up dealing with these patients, and how did the rest of their treatment go? I'd say in every case where they essentially lied and covered up, when it became true, I'd say, I'm happy to keep working with you regarding the ADHD, but I'm not going to prescribe stimulants again because I think the risk is too great. And in all cases, they went to find treatment elsewhere. I have had a smaller handful of patients who I started working with because they were dealing with amphetamine-induced psychosis or had one during treatment with me. And again, with the agreement that we're not going to revisit amphetamines, but I'm happy to keep working with you. So I have continued working with some. So it's not that everyone who had amphetamine-induced psychosis has abandoned treatment with me, but I think it's hard when, again, it's not just the psychosis, it's lying about it. That imposes a barrier, even though I think I could work with that. So with narcissistic personality disorder, how did I diagnose it? And I think I'm down to 2 or 3 minutes. So grandiosity, lack of empathy for others, sort of eliciting why certain behavior, why they did certain things and what they thought of the consequences or what they didn't think of the consequences. Again, there can be considerable overlap between ADHD and narcissism. And I often bring up Frank, who's the patient who got me into ADHD, and he always pronounced it narcissism, which was kind of endearing. But so many sessions he started with, he was on the phone with his girlfriend for 45 minutes, and it was all focused on his health or what he was doing. And then he kept meaning to ask her how she was doing, and they would hang up or end the phone call before he ever got around or could keep it foremost in his mind to ask that. And then he would complain about what a narcissist he was, or that he appeared to be, or that he actually felt he was. And I would try to explain to him, if you're thinking, worrying, caring about her and what she is feeling, that by definition goes against a lot of what the core of narcissism is. But does the behavior look narcissistic? Absolutely. So again, it's getting at what is the person's motivation for behavior that looks selfish, that looks not caring about others, that looks, grandiosity usually is not subtle. And it can be hard when you're working with someone who is particularly intelligent to sort out how much is grandiosity and how much is out of touch with reality. So I previously mentioned brain arousal, which can be felt in the subjective recognition of a dopamine hit is real. Upon getting a dopamine hit on or off again, an agent, I feel goosebumps all over the body. Again, whether that's dopamine or if you're feeling goosebumps, that's almost certainly norepinephrine in your autonomic nervous system. So again, I'm not saying dopamine isn't involved in it, but what you're actually feeling, I would argue theirs are probably feeling some of the norepinephrine, not just the dopamine. And again, when someone says, I feel a hit of dopamine and it's associated with joy, the dopamine reward system, and I have a video about this, is more about anticipating rewards and the matching between expectations and rewards and actual feelings of joy are probably more connected with things like oxytocin, things like opioid system, and things with the endogenous cannabinoid system, anandamide. So again, I'm not denying you're feeling something. I'm just questioning what it is exactly you're feeling. So thank you all for asking great questions. I hope I answered them with some clarity and useful information. And I will be back the next few weeks. I'll just give a heads up. There is a week at the very end of August where I will actually be talking on the Attitude magazine has a consult with the experts or webinar with the experts. So I will be talking about ADHD medications. I think it's stimulant focused. Then I think it's the 29th. It's the first, and at the time they do it, just exact correlates with this. So that week I won't be here. I should be here for the next 3-4 before that. So thanks for showing up. Thanks for asking questions. Thanks for watching the videos and or reading the Medium articles. And be healthy, be happy, and have a good week.